I'm looking forward to chatting with you about bone loss and hip fractures and some preventative tips. So with that, see if we can get the slide to advance. Perfect. So within the next 15 minutes, hopefully I can give you a little bit of an update on how and why hip fractures happen, and go over 5 healthy habits to help prevent fractures, hip and other bone fractures, and bonus points if you're still awake at the end of the 15 minutes. So a little bit here on hip anatomy. So the hip is a ball and socket joint. It's one of the largest joints in the body and a major weight-bearing joint. And because I'm a bone endocrinologist, I have a photo of an x-ray here showing the 2 bones that make up the hip, which are the femur, as well as the pelvis. And the part of the pelvis that opposes the hip joint is called the acetabulum. And then that would be the socket, and then the ball of the joint is something called the head of the femur. And so I'm going to be mentioning fractures here. And when I say fracture, I'm just talking about a broken bone. And if I'm talking about a hip fracture, then I'm referring to a fracture of the femur, which most often happens at either the neck of the femur, which is the right-hand red line on the image on the right, and then there's also something called an intertrochanteric fracture, which is a very common type of hip fracture, which is the other longer red line on the image. And if I mention a low trauma or fragility fracture, what I mean by that is just a bone that breaks as a result of a force or a trauma that wouldn't usually cause a bone to break. So a fall just from standing or ground level, maybe on your carpet or on the ice, that caused a broken bone would be considered a fragility or low trauma fracture. So hip fractures by the numbers, they constitute about 15% of all fractures, and about 30,000 Canadians will unfortunately fracture their hip each year, and about 3,000 of those are Albertans. About 1 in 6 women will have a hip fracture in their lifetime. And even though hip fractures and also osteoporosis are more common in women than men, after we reach age 50, about a quarter of hip fractures actually occur in men. And about 95% of hip fractures happen because of a fall. They're almost always due to osteoporosis, but people can also have hip fractures due to traumatic injuries, such as a motor vehicle collision, or in Dr. Boyd's case, a traumatic sporting injury. So just something to think about there. I'll be focusing more on osteoporosis related hip fractures. So why do fractures happen? And this relates to both the hip bone as well as other fractures. And to think about this, we have to consider both the strength of the bone and also external forces that are applied to the bone. And a fracture happens when the bone is subjected to an external force that's greater than the strength of the bone itself. And there's lots of different factors that determine our bone strength, including the thickness of the bone, as well as the quality of the bone and the architecture, so how all the components are actually built together. And then external forces can be things like a motor vehicle collision, or a traumatic sporting injury, or just a ground level fall, say on carpet or the ice. So to put this in context, if someone has very strong bones and they are subjected to a small external force, then likely there's not going to be a fracture or a broken bone. On the other hand, if we have someone with either very weak bones or a large external force, like a motor vehicle collision, then we can get a fracture. And in some cases, the bones are weak and the force might not even be strong, and that can still result in a fracture. Or on the other hand, someone could have strong bones, but a very big external force, and that could cause a fracture. All right, so I mentioned weak bones. How do we get those? And I think probably most people are familiar with the term osteoporosis. So what exactly is that and who gets it? So the Latin translation would be porous bones. And where that came from is actually originally the way to look at the bones was on autopsy, to take a sample and look under the microscope. And it was seen that actually about 75% of our bone looks like a sponge. So it's something called trabecular, or the other word, fittingly speaking, is spongy bone. And so I've got 2 pictures up here, one on the left showing normal bone, which I think looks like a sponge. Hopefully you can see it too. And then on the right is a picture of osteoporotic bone, which looks like there's lots of sort of holes in the sponge and the connections aren't as thick. And so what osteoporosis is really the bone getting thinner and or weaker, which makes it more susceptible to fracture. And I've just got a little picture here of scaffolding because I think of the bone and the connections and architecture within the bone as being quite like the scaffolding or the foundation of a building. And you can imagine if some of those pieces are taken out, or they're thinner or they're weaker, it's not going to stand up to forces as well. And that's the same with the bone, and that's what happens when we get osteoporosis. So I mentioned osteoporosis is both the thinning and or the weakening of the bones. So how and why do the bones thin? Well, unfortunately, it's all downhill after age 30, and bone loss is pretty much a universal part of aging. So we all hit our peak bone mass in our 20s to 30s on average, and men begin a bit higher than women. And then after about age 30, we start to lose bone on average up to 1 to 2% a year. And this continues up until around age 50, which is approximately the average age of menopause in women. And due to lower estrogen levels after menopause, women actually lose much more bone in that few years after they've gone through menopause. So they lose up to 3 to 5% a year, whereas men are still ticking along at about 1 to 2% a year. And at about age 60, things even out again for women, but they end up lower than men on average. And so that's why osteoporosis tends to be more common in women than men as we age. And so we can actually measure bone thickness and determine how much bone people are losing over time using something called a bone mineral density scan. And some people may have had one of those in the past. They're very common. And what it is a special type of X-ray that usually looks at the lower spine, the lumbar spine, as well as either one of the hips. And it gives us a sense of how thick the bone is. So it tells us the density or thickness, and that can be used in the clinic to help determine someone's individual risk of having a fracture, so a hip fracture or another fracture. However, what we're learning is that it's not just about the thickness of the bones, it's also about the quality of the bone material and how it's all put together in the architecture. And we're actually really lucky here at the McCaig Institute in the bone imaging lab to have something called an extreme CT machine, which is a state-of-the-art high-resolution CAT scanner that you can actually put your arm or your leg into, and it can give us a readout of not only the bone density at the wrist and the ankle, but also the bone quality and the bone architecture. And this is being used in lots of research at the moment, but I wanted to highlight one study because it pertains specifically to hip health. And so this is a study led by Dr. Boyd at the Bone Imaging Lab. And what we're doing in this study is using the extreme CT, so that high resolution CAT scanner, and recruiting healthy individuals who've never had a hip fracture, taking pictures of their bones and comparing those to people who have just recently had a hip fracture. And the goal is to actually be able to use these imaging characteristics to identify people before they have hip fractures in the future. And so the study is still ongoing, but you can see on this slide on the left this picture of a healthy individual's bone, and you can see it's really like the architecture looks really nice. It does kind of look like a sponge. And then on the right, you see an individual who's had a hip fracture, and there's lots of spaces or gaps there or voids, so they do look different. And so we'll be analyzing lots of people, and once that's done, stay tuned. One of Dr. Boyd's grad students is actually using some machine learning technologies to see if we can really proactively determine people's risk of hip fracture. All right, so it's really fun and cool to look at pictures of the bones and analyze those. But I do have to highlight that other factors are very important too, and in addition to just how thick the bones are and how they look. So one of those is age. As we get older, we do lose bone and bone becomes weaker. So as we get older, we're also more likely to have hip and other fractures. If we've already had a fracture, that does put us at risk for having another one. And then other risk factors, unfortunately, we can't choose our parents, but about 70 to 80% of our peak bone density, so as thick and strong as the bone's going to get in our 20s and 30s, 70 to 80% of that is determined by genetics. And then there's lifestyle factors, which I'm going to talk about on a few slides ahead, as well as some medical conditions and medications can make us more likely to fracture. So what can we do to prevent hip fractures? And the good thing about that is the things that we can do to prevent hip fractures can also help us prevent other fractures. So we can focus on maintaining strong bones, and ways we can do that are maintaining a healthy lifestyle. And for some people, I won't have a chance to talk about this today, but in some cases, medications can be helpful for this too. And then we can also do our best to limit external forces. And obviously that's one of those easier said than done things, but driving safely, being careful with high risk sporting activities, and doing what we can to avoid falls. So I'm going to start now with my 5 tips to prevent fractures. So tip number 1 is to eat a balanced diet. And this is a picture here of Canada's food guide that was released last year. And I've got it up here because it really mirrors what we see in observational studies, which are studies where they recruit people and find out what they eat and then look at them over time and see who fractures and who doesn't. And what we consistently see is that people who eat diets that are really rich in fruits and vegetables, that get enough protein, and overall eat more whole-based, home-prepared foods rather than processed foods, tend to have a lower rate of fractures and hip fractures in particular. What you might notice here is that, hey, there's not a lot of dairy on the plate. And well, I thought calcium and dairy were really important for preventing fractures. And that is a really good point. So Canada's food guide has amalgamated dairy in with the protein section of the plate. So it's not as much on the forefront when we look at the new recommendations. However, that doesn't mean that getting enough calcium isn't important for fracture prevention. And so I just wanted to highlight this. Our Canadian guidelines recommend that we get about 1,200 milligrams of calcium in our diet a day. What I will mention here is that our Canadian guidelines are very conservative, so they want to make sure that everyone's getting absolutely enough calcium. A lot of the research that exists suggests that maybe 700, 800 to 1,000 milligrams is probably okay for the average person. And if we were living in a different country, some places like the UK and Scandinavia recommend about 700 to 800 milligrams a day. So in my clinic, I'm usually happy if people are able to get 800 to 1,000 through their diet. And you can actually get about 300 to 400 through a balanced diet that doesn't include any dairy or any specific sort of trying to get calcium in. But if you do consume dairy, it's a great way to get that extra top up of calcium. But this image on the right on this slide is from the US Department of Agriculture and shows lots of non-dairy foods that are very rich in calcium. So for each of my tips, I've got a little quick action that you could take right away to sort of start using that tip. And for this one, I suggest maybe getting a recipe and trying making a meal with a calcium-rich food that you haven't tried before that's new to you, just to get it on your mind and get thinking about it. And people often ask me in clinic, okay, but what about calcium supplements? Should I take one? And what I will say is this could be its whole hour talk on its own. So I'm not going to get into that in detail. I'm happy to answer any questions about it though at the end. But in general, if you're getting enough calcium in your diet, there's not a lot of evidence for a benefit of taking a supplement. So diet is best in this regard. And then tip number 2, get enough vitamin D. So vitamin D helps our body absorb calcium. And we get it not only from our food, although food is not a great source of vitamin D, we can also get it from supplements, and our skin makes it in response to sunlight, UV light. And so if we were living, say, in Florida right now, closer to the equator, getting lots of sunlight outside year round, we might not need to take any vitamin D, although our research in Calgary specifically, as well as across Canada, shows that if nobody took vitamin D, about 1/3 to half of us would have vitamin D levels that are low enough that they could be detrimental to our bone. So the general recommendation is to take a supplement, and anywhere between 400 to 2,000 seems to be safe and effective to getting us to the levels that we need. And in our Calgary vitamin D study, which I'm going to talk about on my next slide briefly, we found that actually 400 gets people to a pretty reasonable level. So for about 90 to 95% of the population, that should be just fine. Although your doctor might recommend a higher dose if you're at risk of deficiency or known to be deficient. So a quick action you could take today if you are not taking any vitamin D, especially going into the winter, is maybe consider starting a 400 international unit supplement, or if you're on a multivitamin, you might be getting that much already. So that's something you could check. And I'm just going to highlight a second research study ongoing at the McCaig Institute at the Bone Imaging Lab. And this is again run by Dr. Boyd as well as Dr. David Hanley, who's a professor emeritus at the University of Calgary. And I was lucky enough to be involved in this study with them. And what we did, it's completed now, but we randomized over 300 people, all from the Calgary area, to get vitamin D, a daily dose of either 400, so that was the dose that I said is probably reasonable for the majority of people, or high doses of 4,000 or 10,000 international units a day. And they took this for 3 years, and we used this extreme CT technology to get nice images throughout that time of their wrist and their ankle. And what we actually found, which was a bit of a surprise, was that the people on the highest dose actually lost more bone than the people on the 400 international unit dose. So in general, more is not necessarily better, and 400 for the majority of people tends to be fine. And tip number 3, again, this is another easier said than done one, but kick unhealthy habits. So we know that people who smoke are 30 to 40% more likely to have a hip fracture. And we know that consuming more than 2 drinks a day is associated with a higher fracture risk. And so what is a drink? Well, this image on the left is not your standard drink. So your standard drink would be a typical glass or bottle of beer, 5 ounces of wine, or 1.5 ounces of spirits. So some people say, okay, I might not want to drink again at all, and I'll switch to water. Fine. However, if you want to continue to drink and maybe just reduce your portion size, there actually is research out there showing that if people drink out of tall, thin glasses, they feel like they're drinking more than drinking out of short, wide glasses. So take that as you will, but something to consider. Right? And I've got 2 more tips here. So tip number 4 is exercise. And we all know exercise is important for so many health benefits. And we know that for preventing osteoporosis and preventing falls, it is also important. The recommendation in Canada is about 150 minutes of moderate to vigorous, so 5 to 8 on a scale of 1 to 10 activity each week, and it should be weight bearing where possible. Jumping has really good data in terms of bone outcomes, but there's lots of other weight bearing activities. And while things like swimming and cycling aren't weight bearing, they have a lot of other excellent health benefits. So if that's something you do and enjoy, it's good to continue. Maybe just try to pepper in some weight bearing activity too. But then things start to get even more detailed with the recommendations. So our Osteoporosis Canada recommends daily posture and balance exercises, as well as resistance training 2 to 3 times a week. And putting that all together, it's a lot. And it's a lot to think about, well, what do I actually do? Ideally, people could work with a trainer and have a program that's tailored to them, but of course that's not always possible. And so a really good starting point that I recommend is going to the Osteoporosis Canada website, which is osteoporosis.ca, and they have an excellent booklet called Too Fit to Fracture. It has recommendations as well as pictures of some starting exercises, posture, balance, and resistance that you can try. So that's a great starting point that you could do today. And tip number 5 is, again, another easier said than done one, but don't fall. So mitigate your falling risk where you can. So maybe don't walk on any tight ropes in the sky. And then also we know that exercise, specifically balance exercise and things like Tai Chi, are really good for reducing the risk of falls. So what you could do as a quick action today is maybe start a daily balance practice, just something as simple as standing on one leg at a time for 30 seconds while you're brushing your teeth or waiting for the kettle to boil. All right, I'm almost done, I promise. So in conclusion, my 5 tips to maintain bone health and prevent fractures. eat a balanced diet with calcium, get your vitamin D, kick your unhealthy habits, exercise, and don't fall. Thanks very much. Oh, and actually just want a really quick point here. If you want more information, our local website from the Dr. David Hanley Osteoporosis Center is a good resource, as well as osteoporosis.ca from Osteoporosis Canada. Thank you.